And last but not least, I'd like to welcome Nicki Killeen, who I know is well known to a lot of people. Nicki is a project manager, don't fall off the stage, is a project manager in the HSE National Social Inclusion Office, responsibility for improving responses to emerging drug trends and new user groups. Now Nicki is, if you're savvy on social, you'll know Nicki well, and Nicki certainly, she has responsibility for coordinating a lot of the communication projects on drugs.ie. Most recently, she has coordinated the HSE's multi-component festival outreach programme, which is very recent work, and I know there was a lot of media coverage about that, so it's a very timely presentation. Today, Nicki's talk is entitled Monitoring Drug Use in Nightlife Settings, Advantages, Challenges and Results from the HSE Safer Nightlife Programme 2022. Thank you.
Hi everyone. Thanks for hanging around. We should have left by now. And then here I emerge with loads of slides because I love talking about drugs in nightlife. So I won't touch on everything on all of my slides because I do have a packed presentation. So if there's anything I don't touch on, just let me know and we can chat after. So what I'll be touching on today won't be the amazing work done throughout Europe. You know, people have been monitoring drug use in nightlife settings since the 90s. For us, it's relatively new. So what I'll be discussing today is, I suppose, the HSE's work since 2019 to jump into nightlife settings and to look at this because it is a very new space for us. So there's a lot of advantages, obviously. We've faced a lot of challenges, and I suppose what people are probably most interested in is the results from our back-of-house pilot at Electric Picnic. So today we've recognised we have a new landscape, things have changed, things aren't as they were. We have many new user groups. I suppose if we're looking at the wider social context, we've evolving markets, which everyone will be aware of, increased supply of cocaine coming from increased production in South America. There's increased production of synthetic substances in Europe, particularly methamphetamine, and if we're looking at foresight planning, we're looking at what impact that will have at reduced prices and what that means for Europe. Although at a lower rate, we still see new psychoactive substances emerging. I think the EMC today are monitoring over 800 now, with over 50 identified for the first time last year. Of concern to the HSE is the emergence of new psychoactive substances in traditional drugs, so people being unaware that they're being exposed to more potent substances. So at the moment, we're really concerned about the cannabis market, about synthetic cannabinoids emerging in vape, edibles, herbal products, and we're also concerned about the re-emergence of cathinones, which we'd all remember from the head shop times, but now we're seeing those in stimulant-type drugs without people knowing. In terms of social cultural influence, I think this is a really interesting time. We've seen significant change over the past decade. And in terms of social media, we generally look at its role in supply. It's transformed all of our lives significantly in how we communicate, who we are, our online personas. So this is having an impact on, I suppose, bringing subcultures and youth cultures into a very mainstream space. So we tend to overlook the role of social media in influencing drug trends and who uses drugs. So another part that social media is playing, I suppose, is the proliferation of nightlife. So raves and the MDMA subcultures would have been far more underground. It's very, very public now, with people boasting, I suppose, online that they're at secret events, which aren't very secret because they're exposed on social media. We have a number of new user groups, and I suppose for us to be truly inclusive, we need to look at all of the user groups. Who is using substances? Who are at risk? You know, the closing gender gap was discussed today, and we are seeing that particularly in relation to stimulant substances. So for us, we are concerned about what that means in terms of risk. Polydrug use has become the norm, so our responses have always looked at monodrug use. We now have a society of polydrug users, so we need to change how we think, and I know that was addressed today. In terms of all of the signals of harm are all increasing, so everything is increasing in a direction which we are concerned for. So when we're looking at our substance use groups, we have services which we engage with the most marginalised, and you know, we've heard today, you know, they are the most marginalised, they're the most at risk to harms, most excluded in society. But I suppose what we haven't looked at is the evolving user groups, and while we have services for one user group, we are significantly missing others. So the general population, people who use substances in nightlife, other genders, including our services for those. And I suppose the last and final group are our psychonauts, so groups that we are really hidden and we're not engaging with, all at risk of changing drug markets, all at risks of harms, and all in need of harm reduction. So in terms of the nightlife setting, this is the setting, I suppose, that we've been looking at to try and use as a health and social intervention setting. While people have worked in this setting since the 90s in the Netherlands and other countries, we haven't really looked at explored this setting. So we know, it can be used, but I suppose we are having challenges for many reasons of the health service now working in new ways with new groups and looking at socio-cultural influences in different ways. So overall, internationally, we've seen the proliferation of the nightlife scene, the commercialisation, and an upsurge in, I suppose, nightlife and nightlife tourism, and what is branded as experience. So your substances and your package of your festival ticket is almost an experience. And I know others in Europe have looked at experience tourism, where you go on holidays to festivals and your substance use is part of that package. So I suppose the pills on the right, people probably don't recognise, but I suppose they're significant to young people in dance culture. We have a Berghain pill, which is a club in Berlin. We have an ADE from the Amsterdam Dance Event and Tomorrowland. So that's just showing, I suppose, the cultural significance of MDMA within that community, and I suppose the package of experience or experience tourism where you can have branded MDMA for your event. In terms of nightlife, we've discussed gender a lot today, and gender, class and ethnicity can no longer be seen as predictive or preventative factors. So nightlife is an equal space where all genders are inclusive, and substance use is, I suppose, the norm there. While we look at ACEs and other factors influencing use in this setting, culture and socio-cultural influence are the predominant features. So substance use is part of leisure activities, youth culture, fashion. If we look at, I suppose, this space again, we might not look at the measurement, so not the quantitative levels of use, but the embeddedness of that pattern of use within that culture. So this has been discussed for some time, since the late 1990s and early 2000s, with normalisation thesis and cultural accommodation. So in terms of health harms, why the HSE want to work in this setting, I think in 2015 the EMCDDA looked at the Global Drug Survey, and frequent nightlife users had 4 to 25 times higher rates of use than the general population. So there's high rates of use. Polydrug use is the norm. People are moving from occasional to frequent use for the duration of a festival, using in risky ways. The intersection of other harms, sexual assault, harassment, violence, all come to play, I suppose, as part of campsite relations and festivals and other settings. So I suppose of particular concern to us in terms of preparedness in the future is that we don't know what's in the drugs. And I suppose the example of PMA and PMMA from a number of years ago, I think from about 2012 to 2017, we'd about 40 cases where PMA and PMMA were referenced on people's drug toxicology. So for those who don't know, these substances emerged due to I suppose a change in the European supply of MDMA, where these substances appeared instead, sold as MDMA, are toxic at lower doses, take longer to kick in, so people were taking more, led to a series of deaths throughout Europe. If you look at the most available drug-related death data, we've had more deaths associated with these substances than we have fentanyl. Yet we tend to overlook the significance of those deaths and the significance of drug market shifts to do with this setting. In terms of monitoring, Trimbos in the Netherlands identified very worrying PMA trends quite early on, and were able to stop deaths associated with those substances. Other countries, such as ourselves in the UK, didn't have formal monitoring in place at that time, and we did see a number of issues. So just to look at the deaths, the figures are rising on club drug deaths, and as I did mention, PMA for the period of 2012 and 2017 is concerning. So I suppose for us, looking at preparedness and looking at the future, substance analysis and knowing more about nightlife settings is important to us. So when we looked, we had a number of knowledge gaps, that we have services that people are coming in every day, addiction services nationally, which do great work, but we're not engaging with nightlife populations, club drug users, and the psychedelic users and psychonauts. So we knew, it was going to be a challenge to engage with this population. How would we do it? And that we could use the nightlife setting to overcome this barrier. I suppose in terms of prevention and education, there are many challenges. There is a need for more prevention and education, I suppose, to prevent the early onset of use, but also to educate young people now in a new way. I think it was also discussed today that young people are navigating a sea of disinformation and a sea of information about substances. It's harder now to engage online, and it's not as simple as just putting out messages that will appeal. So there is a disconnect there, and there's a lot of work to overcome that. In terms of research, our traditional data sets may not have been capturing these groups, so we've really great robust surveys such as SPAD and our general population survey. They generally may miss hidden user groups, they may not look at specific settings, use behaviours, and some of the questions that we needed answers on polydrug use or future intentions to use. So if people haven't used recently, will they use at nightlife events? And then finally, I suppose one of the biggest gaps is that we need to know what's in the substances. So not just in nightlife settings, across the board, we need to know what's in the substances to be prepared. So while seizure data is extremely helpful, and Yvonne and colleagues link with us on all the questions that we have, we know that we may not be reaching the full extent of the drug market to get the information we need to reduce the harms. So we took a number of steps. We linked with international organisations. We've linked with colleagues throughout Europe on what they apply in nightlife settings. And we needed to do some specific research. So in 2019, we did an online web survey with Trinity College. We promoted it online. And we got over 1,100 respondents. And we really wanted to look at use specific to festival settings, both in Ireland and abroad. So linking in with that theory of experience tourism and nightlife tourism. We saw, what we thought was high female use. We saw that these populations were very different to the people coming into our services, but we did know that they're at risk of harm, so they are using substances in very risky ways. While there was a high level of harm reduction reported, there was a very low level of mono use, so really high levels of polydrug use with people using 3 to 8 substances per event. Now, this is just a very brief insight. We need to know more about the timing, why, and the substances people are mixing together. So overall, with this survey, we were able to confirm, yes, there's high levels of substance use in Irish festivals and at festivals abroad. We were able to get information on some substances that we hadn't looked at before, so ketamine, nitrous oxide, 2CB. I think it's important to note the limitations of surveys in that a very small number said they were taking unknown pills and powders. Essentially, I would argue that all the substances are unknown because we don't know what's in them. So there is a limitation with surveys that the young people themselves do not know what they are taking. In terms of health and harm reduction responses, it was quite significant to us that there is a disconnect between health services and this population. Many are afraid to get help if they do become unwell in a festival setting, and this is an area we need to overcome. So we do know as well, anecdotally, that speaking to people at festivals, even this year, that there's a lot of misconceptions that they might get removed from the festival. They've spent quite a lot of money to get to the festival, and they're afraid that their friend group will be removed. They're afraid of legal what may happen to them legally. So there's a lot of work to be done on the ground, I suppose, chatting to young people about that. So finally, we had a working group that to look at the issue. It was our last action on it. We brought together stakeholders who'd never come together before, nightlife community, students, psychiatrists, and the Department of Health, the Department of Justice, Gardaí, Forensic Science Ireland. And we looked at the two broad issues of nightlife substance use and how we can improve our responses through substance analysis. So there was 15 recommendations on how we need to improve our work, which led to a pilot programme this year in terms of doing outreach. So in the absence of a dedicated nightlife service, that we trial a volunteer programme, and that we try to couple that with some form of analysis through a back-of-house approach. We did know there would be a lot of challenges, back to the fear of legal repercussion, young people having limited drug education, stigma. With this group, there is quite a lot of stigma as well, uncertainty, and that there is no dedicated service, so that relationship is starting from scratch. So we piloted our Safer Nightlife Programme this year across 3 festivals. Myself and my colleague Nicola Corrigan, we recruited volunteers from a range of different backgrounds, students, peers. We looked at resource development, a media campaign, and we were on site at 3 festivals. So the first 2 didn't have the back-of-house approach, the Electric Picnic did. So the first 2 festivals, we had got a good sense of what was going on the ground. There was increases in ketamine. We were working through questions and concerns that people had. Basically, we just told our volunteers, we need you to be really sound. We need you to work from a harm reduction ethos, and we need you to support people any way you can in the festival setting. So what we got as well at a lot of the first 2 festivals is, why can't I check what's in my substances to help me reduce the harm? That was a constant question that we got. So while we were preparing to work at the first 2 festivals, there was a lot of discussions and negotiations going on behind the scenes to look at how we could operate a back-of-house pilot at Electric Picnic, which was September. So this involved a multi-stakeholder approach with ourselves, the National Drug Treatment Centre. Sinead and Siobhan were leading on the analysis. We were working very closely with the Department of Health and An Garda Síochána and festival promoters. So the timeline ended up being very short for this work. We ended up getting the back-of-house pilot over the line in 3 weeks, which is quite phenomenal for all involved. I'm not one for giving ourselves a pat on the back, but it was a very, very quick turnaround. But we did it, and we got there in the end for Electric Picnic. So what was agreed was that we would be on site at Electric Picnic with our harm reduction teams. We would deliver our outreach as we had at the first 2 events. But what would be different was that we could have 2 surrender bins where people could surrender substances in a HSE tent and a Code Blue medical tent. These substances would then be in the possession of the HSE and the National Drug Treatment Centre lab for analysis for health-specific purposes. We knew there would be some challenges with this approach. It was a proof of concept. It was a pilot. There would be communication challenges. So we were working very hard on the ground with our volunteers, and then we had an extra layer of additional challenges that people may have seen through media and social media, which were questioning the operational elements and the policing of people utilising the bin. So I'm flying through this very, very quickly because I know you all need to get home. So I'm going to move into the final phase, is what our results of what we found in our first pilot. So as I said, the analysis was conducted by the HSE National Drug Treatment Centre lab. They established an on-site lab in Electric Picnic, which was away from the public access. They were using FTIR spectrometer. If anyone has questions about that, Sinead is the person to go to. But essentially it looks for a fingerprint trace of the drug. It does have many benefits in that it's portable, and it was very easy to implement our first pilot with this machinery to move it to the setting. There are some limitations in what it can do and detect in low volumes of substance present at under 10%. So in total, we got 46 samples, 42 of which have been confirmed, 4 of which are still unconfirmed. And what that means is that the substance libraries or the standards weren't available for the lab, but I think we're going to work on that to get those looked at. What we did find was very interesting, and I'll go through some of the key drug trends. So 34 of the substances were analysed with the FTIR on site at Electric Picnic. The lab, as Sinead explained, have a Dublin-based centre in Dublin too, and they use LCMS. So the further substances were subject to analysis there after the event. So our operations and communications at the event, obviously we received a number of substances, but we only communicated on 3. We looked at 3 trends which were quite concerning to us. The first on the Friday evening was a high-strength MDMA pill, a My Brand Skull, which was 235 milligrams of MDMA. That's about 2 times the average adult dose, so very easy for a person to overconsume. It was also very difficult to break, so it was very hard to break in half if someone wanted to implement harm reduction. Secondly, we were quite concerned about the potency and strength of the powders. So the powders were extremely high strength MDMA, which could be very difficult for a person to know how to dose for harm reduction purposes. There's also a misconception with young people that powders mean safer. So we're aware of that from our chats with young people on the ground. Finally, I suppose unexpectedly, we found a number of NPS which was unexpected. I suppose the 3-CMC was less unexpected because we're seeing the emergence of cathinones in Europe. I suppose what was unexpected was that we got quite a lot of it. So there was a large sample of 3-CMC powders sourced within a medical bin. So while we don't know if the person that left this in the bin had thought this was MDMA or knew it was a cathinone, we do know that this substance was linked with a medical presentation at the festival. So we're very concerned about cathinones. As I'm sure all of you would remember from the head shop era, we had very difficult, complex cases with our clients, suicide ideation, adverse mental health reactions. So we were afraid that, and what we're seeing in the UK is that people are mistakenly taking what they think is MDMA pills and crystals, and they're exposed to a cathinone. It's leading to prolonged insomnia, anxiety, suicidal feelings. and it can lead to overconsumption. So it's easier for someone to overdose because they feel the need to continue taking. As you'll see here, and I won't say the chemical names for all of these substances, but we found a range of very interesting substances at Electric Picnic. So for me, that was unexpected, that we were going to find 12 new psychoactive substances. Some of these are very novel. They're less discussed in the context of Ireland, which I'll get on to now. So in terms of our MDMA, I suppose what's concerning from a harm reduction approach is the diversity in the samples, so 36 milligrams to 235. This can make harm reduction communication very difficult. You're trying to communicate that you don't know what's in the pill. Some could be super strength. People may not be able to gauge their tolerance each time they take the substance. They can have a different reaction. It can be very difficult to communicate that. We found 6 identical pills with the same press in different colours, again ranging from 36 milligrams to 235. Shows us that it is difficult to look at sites that may say this substance is dangerous, this substance isn't. There's really no way of knowing without the analysis. One pill was also found to contain mephedrone, again a popular cathinone that we'd remember from the head shop times at low doses. So again, this gives us an insight that we haven't had before in terms of the quantification of MDMA in Ireland for the first time, but it can provide us a baseline because there's too much diversity. So we do need more analysis to get more insight on the MDMA market. Finally, I know I'm keeping this now within my 20 minutes, so I'm trying to go really fast. These are the substances that I found the most interesting and that I wasn't expecting us to get. So we found a series of new psychoactive substances, 9 of which were submitted to a surrender bin, packaged with the labels on them. Many of them are considered, well, they're all considered new psychoactive substances, but they may not be new. So a number of the substances have been, in literature for some time. Many are associated with Alexander Shulgin. So he has 2 books, Pical and Tical, tryptamines that I know and love, and phenylethamines that I know and love. And these would be, I suppose, known within a psychonaut community who want to explore these substances. So Shulgin would have explored these substances at the time with his community and wrote about them. So we know from the labels that we got this from a very educated person who knew what they were taking, and someone that is likely part of the psychonaut community. There is an association with online communities. For us, this is a group that we don't reach. We consider them a hidden population. We did capture some new psychoactive substance use in the recent EMCDDA web survey on drugs. We got 214 people, and some of the substances were first noted there, but we hadn't detected them through analysis yet in Ireland. So what we did also find was 3 of the substances, you'll see them there, were the first detections in Ireland, which is really significant. So it shows us that by taking this approach, we now have reached a group. We have now reached substances that we've never found before, but the question is then, how can we help this group reduce the harms? So we need to continue researching and engaging on outreach. Just to look at some of our media results, we had significant, I know it was mentioned by Yvonne at the start, we had significant media attention. There was a constant flow from May to September with questions and interviews about festivals, about drug trends, and we got significant reach, particularly on the Friday evening when we issued the first risk communication on the purple pill. While we received a low number of samples, I think it's important to reference the significance of our first pilot. We've worked with new stakeholders in new ways. We've worked with Gardaí, we've worked with Department of Culture, we've worked with nightlife stakeholders, all with a collective aim to reduce harm. So looking at how we can obtain substances to inform harm reduction. We're looking at changing the mainstream dialogue, so this brought harm reduction into a very new space across the media, looking at how the HSE can progress this. This may in turn have an impact on stigma reduction, but we don't know yet. And I suppose the MDMA quantification is significant to us because we've been looking at UK results for some time, and often you lose credibility with the user group because you're reporting on other countries' data and not our own. So our next steps, on my final slide, you'll all be happy to hear because you're all free to go. So we're looking at a number of different areas. I suppose on the pilot, we want to get feedback from our stakeholders, our volunteers, those we've worked with. We'll be kicking that off in the next few weeks. We want to conduct a survey with people who use drugs to get their feedback on the campaign, on the pilot approach, and how we can improve. We want to review with Gardaí and the Department of Justice and Department of Health on how we can increase access to substances, so how we can look at gaining substances outside of nominated events, how we can continue to monitor drug trends in Ireland. We're expanding monitoring, and I know the Minister mentioned that earlier, working very closely with the National Drug Treatment Centre Lab to obtain new staff, to continue growth on not only the back of house approach, the syringe analysis approach. We'll also be looking at surveys. Very interested in the EMCDDA's hair analysis, but we can't say if that's going to happen here yet, but that would be amazing if we could kick that off. And we'll be looking at a working group specifically to look at monitoring drug use in nightlife settings. So thank you.